What if the pill you've trusted to protect your health has been quietly reshaping it in ways you never imagined? Metformin has long been a cornerstone of diabetes care, celebrated for lowering blood sugar, improving insulin sensitivity, and earning a reputation as one of the safest prescriptions in modern medicine. It's so common that many see it as a harmless daily routine, barely worth a second thought. But behind its well-known benefits lies a quieter story, one rarely discussed outside the doctor's office. Some changes arrive so slowly, you might mistake them for the natural signs of aging, the stress of a busy week, or just an off meal. Others show up more sharply, draining your energy, unsettling your digestion, or quietly interfering with how your body absorbs vital nutrients. And here's the real concern: these effects can build for years before you connect them to the tiny tablet in your hand. This isn't about fear, it's about clarity. Because for every person who thrives on metformin, there's someone else managing side effects they never saw coming. In the next few minutes, we'll uncover 10 of those overlooked effects, the ones that could completely change the way you think about this familiar medication. Side effect number 1. Digestive distress. One of the earliest and most common side effects of metformin is trouble in the gut. Many people notice changes within the first few days: nausea, bloating, stomach cramps, or sudden diarrhea. This happens because metformin works partly by reducing sugar absorption in the intestines and altering how the gut processes carbohydrates. While this helps control blood sugar, it also increases the movement of food and fluids through the digestive tract, which can lead to discomfort. Doctors often reassure patients that these symptoms fade after a few weeks, and for some, they do. But for others, the irritation lingers for months, making each meal a bit of a gamble. Imagine enjoying your favorite dinner, only to find yourself rushing to the bathroom an hour later. Some people find relief by taking metformin with food or switching to an extended-release version, which releases the medication more slowly and can be gentler on the stomach. However, these adjustments don't work for everyone. The challenge is that these digestive problems can easily be mistaken for irritable bowel syndrome or food intolerances. That can delay the moment you connect the dots and realize the medication itself might be the trigger. For those affected, the discomfort isn't just physical. It can change eating habits, social plans, and overall quality of life. And this is only the first side effect your doctor may not be eager to emphasize. Side effect number 2. Vitamin B12 deficiency. Metformin's impact on blood sugar is well known. What's far less talked about is how it slowly chips away at your body's vitamin B12 reserves. This isn't an overnight change. It can take years before symptoms start showing, which is why so many people miss the connection. B12 plays a critical role in keeping your nervous system healthy, supporting red blood cell production, and maintaining mental clarity. But metformin interferes with the absorption of B12 in the small intestine, meaning that even if your diet is rich in animal proteins, eggs, or dairy, your body may still struggle to get enough of this essential nutrient. At first, the signs are subtle: a little more fatigue than usual, difficulty concentrating, or a dip in mood. Over time, nerve-related symptoms can appear, like tingling or numbness in the hands and feet. In more severe cases, low B12 can mimic conditions like dementia or multiple sclerosis, leading to unnecessary worry and even misdiagnosis. The fix can be straightforward: regular blood monitoring and supplementation, but here's the problem. Many patients are never advised to track their B12 levels until symptoms have already taken hold. The silent nature of this side effect means it can quietly undermine your health for years without you realizing. And as you'll see in the next point, metformin has another long-term effect that can be just as easy to overlook. Side effect number 3. Lactic acidosis. For most people, metformin is considered safe. But there's one rare complication that demands attention: lactic acidosis. While uncommon, when it does occur, it can turn life-threatening in a matter of hours. Lactic acidosis happens when lactic acid builds up in your blood faster than your body can process it. Under normal circumstances, your liver and kidneys work together to clear this acid, keeping levels in check. But when those systems are compromised, whether from kidney disease, severe infections, dehydration, or even heavy alcohol use, the balance can tip dangerously fast. The warning signs can be easy to miss at first: unusual muscle pain, deep and rapid breathing, unexplained weakness, or persistent stomach discomfort. They're symptoms many might dismiss as the flu, indigestion, or just feeling under the weather. But with lactic acidosis, every hour counts. Left untreated, it can lead to low blood pressure, shock, and organ failure. While the overall risk is low, it's higher in people with reduced kidney function, chronic illnesses, or those who regularly drink alcohol while on metformin. The best safeguard is awareness, knowing that these symptoms, especially if they appear suddenly, require immediate medical attention. Understanding this side effect isn't about creating fear, it's about making sure you can spot the difference between a harmless sick day and a true medical emergency. And as we'll see next, metformin can also have an impact on your digestive system that's far more common, but often just as disruptive. Side effect number 4. Unexplained weight changes. Metformin is often seen as a quiet ally in weight control. Many doctors even mention its tendency to promote modest weight loss. But this isn't everyone's story. For some, the scale begins to creep upward, and the reason isn't always obvious. This unexpected shift isn't necessarily about eating more or exercising less. Metformin can subtly influence how your body stores fat, how efficiently it uses glucose for energy, and even how hormones involved in appetite regulation behave. For certain people, these changes work in their favor. For others, they can set the stage for gradual weight gain. At first, the difference may seem small, a pound here, 2 pounds there. But over months or years, that quiet climb can become hard to ignore. And when your expectations were set on shedding weight, the emotional impact can feel heavier than the physical change itself. Frustration builds, not just from the number on the scale, but from the sense that your body isn't responding the way you thought it would. The takeaway isn't that weight changes on metformin are inevitable, only that they're possible in both directions. Awareness allows you to track your progress honestly, and to work with your doctor on adjustments if the scale moves in ways you didn't anticipate. And speaking of changes that can catch you off guard, the next side effect is less visible on the outside but can have a surprisingly big impact on your day-to-day comfort. Side effect number 5. Metallic taste. It may seem like a small inconvenience at first, but taste is a big part of how we enjoy life, and metformin can quietly interfere with that. For some, every sip of coffee, every bite of a favorite dish, carries an unwelcome undertone, a faint but persistent metallic tang. It lingers in the background, subtly reshaping the flavors you once looked forward to. This isn't dangerous in itself, but the effect can ripple through daily habits. Meals become less satisfying, appetite can decline, and over time, that can lead to unintended weight loss or nutritional gaps. Some people adjust and barely notice after a few weeks, while others find it frustrating enough to change what and how they eat. Because taste is so closely tied to appetite and mood, this side effect can influence more than just the palate. It can alter routines, social meals, and even motivation to cook. But taste isn't the only subtle shift metformin can bring. For some, its effects reach into areas of health you might not expect at all. Side effect number 6. Muscle weakness and fatigue. There's a kind of tiredness that sleep can't fix, a slow, heavy exhaustion that lingers no matter how much you rest. For some people taking metformin, this fatigue is paired with muscle weakness, turning simple tasks into unexpected challenges. Climbing a flight of stairs, carrying shopping bags, or even standing for long periods can start to feel like a workout you didn't sign up for. This isn't just getting older or being out of shape. In many cases, the problem ties back to how metformin affects nutrient absorption, particularly vitamin B12. Over time, low B12 can disrupt nerve function, weaken muscles, and drain your energy levels. On top of that, metformin can subtly alter how your body processes glucose and creates energy at a cellular level, leaving you feeling like your internal battery never quite reaches 100%. The tricky part is that these symptoms build slowly. You might chalk it up to stress, busy schedules, or poor sleep, never realizing your medication could be playing a role. Without proper testing, people can live for years with preventable weakness and fatigue, assuming it's just part of life. When muscle strength and energy return after addressing the root cause, the difference can feel like night and day. And for many, that moment of clarity comes only after connecting the dots, or being told something their doctor might not rush to mention. The next side effect might make you rethink what you've been ignoring all along. Side effect number 7. Skin reactions and rash. Skin changes are one of the body's clearest warning signals, yet they're often overlooked when linked to medication. With metformin, some users notice unexpected rashes, redness, or itching, sometimes mild, sometimes more persistent. What makes this tricky is timing. These reactions may not show up immediately. They can surface days or even weeks after starting the drug, making it easy to blame a new soap, detergent, or even food instead. In most cases, the reaction is harmless and fades once the body adjusts. But in rarer situations, these symptoms can point to something more serious, like an allergic response. This could involve swelling, blistering, or skin that feels hot and inflamed, all signs that the immune system is reacting strongly. The skin is more than just a protective layer, it's a messenger. When something inside the body is off, whether from an immune trigger, chemical sensitivity, or inflammation, the skin often reveals it first. For those on metformin, noticing new or unexplained skin changes can be an important clue that the medication is affecting more than just blood sugar. Sometimes, it's the smallest changes that signal the biggest stories beneath the surface, and the next side effect on our list proves just how interconnected the body really is. Side effect number 8. Mood changes and mental fog. Metformin is often seen as a medication that works only on blood sugar, but its influence can reach further, sometimes touching the way you think and feel. For some, the shift is subtle, a little more irritability, moments of unexplained sadness, or that frustrating sensation of a mental fog, where focus doesn't come as easily as before. Researchers are still untangling the connection, but several possibilities stand out. One is nutrient absorption, particularly vitamin B12, which is vital for brain health. Another is the gut-brain connection, since metformin can alter the balance of gut bacteria that play a surprising role in mood and cognition. It may also be the body's broader metabolic adjustments sending quiet ripples into mental well-being. What makes this tricky is how gradually it can happen. A small dip in energy here, a slight change in mood there, until it becomes part of your everyday reality. If you start feeling different in ways you can't quite explain after beginning metformin, don't ignore it. These internal signals, even when subtle, can hold important clues about how your body is responding. Side effect number 9. Sleep disruptions. When mood, focus, and energy are affected, sleep often isn't far behind. While metformin doesn't directly target the brain, some people notice unexpected changes in their nights. Trouble falling asleep, waking often, or feeling as though rest never quite reaches that deep, refreshing stage can slowly wear you down. Others describe restless legs that keep them shifting under the covers, or vivid dreams that feel almost too real. The science hasn't caught up to the stories yet, but several theories exist. Shifts in blood sugar during the night, changes in gut microbiome activity, or the medication's ripple effect on hormones could all play a part. And once sleep falters, the consequences add up quickly. Higher stress, less stable blood sugar, lower immunity, and a constant drain on daily energy. What begins as a few restless nights can, over time, reshape your mood, your health, and even your relationship with the medication itself. Sleep isn't just a comfort, it's one of the body's most powerful tools for repair. When that's disrupted, everything else feels a little harder. Side effect number 10. Changes in taste for sweets. When your sleep shifts, it's not just energy and mood that change, even your senses can start responding differently. Among the more unexpected reports from metformin users is a noticeable change in how sweet foods taste. For some, desserts and sugary snacks lose their familiar appeal, the flavors muted as if someone turned the volume down. Others find the taste for sweets fading almost entirely. At first glance, this might seem like a hidden advantage, especially if you're aiming to reduce sugar. But food is tied to more than just nutrition. It's linked to comfort, celebration, and personal routine. When your favorite treats suddenly feel flat or unfamiliar, it can leave you feeling oddly disconnected from the foods that once brought joy. This quiet shift may be more than a quirk of taste buds. It can signal deeper metabolic changes in how your body processes and responds to sugar, a reminder that metformin's influence can reach into places you might never expect. Metformin has earned its place as one of the most trusted tools for type 2 diabetes management, yet even the most familiar medicines can hold surprises. From subtle taste changes to shifts in mood, sleep, or digestion, these effects are reminders that your body's story is deeply personal. The real advantage comes when you notice the patterns, connect the dots, and understand how small changes can reveal big truths about your health. Sometimes, it's not the prescription itself that shapes your well-being, it's the knowledge you carry alongside it. And when it comes to metformin, there may still be chapters waiting to be uncovered, each one changing the way you see your own health. The next chapter might just surprise you, and it's closer than you think. If you found this video helpful, subscribe to the channel, like the video, drop your thoughts in the comments, and share it with your loved ones, especially parents and grandparents who could benefit from knowing this.